Tooth pain is the worst. I've even had patients tell me they'd rather go through pregnancy again than have a toothache. Now, obviously I can't compare that, but before you try every remedy you see on TikTok, these are 10 of the best ways to get rid of any toothache. Hi guys, I'm Dr. Singh, I'm a licensed dentist, and while these tips can give you some temporary relief, I want to make sure that you know that it's important to go and get seen if you have tooth pain, because tooth pain usually will never fix itself. So all these things I'm about to mention, use them as a way to kind of mitigate that pain until you're able to actually get seen by a dentist. Don't ignore going in. Now let's get into it. Number 1 is salt water rinses. Just mix like 1/2 to 1 full teaspoon of table salt into warm water and then swish it around for like 30 seconds and then spit it out. You can do this like even like a few times a day, but this is really good if you have like irritated gums or if you have some sort of swelling going on, or even if you have like some sort of mild abscess that's brewing. Salt water is also antibacterial, it's soothing, and it can help promote wound healing. And it can kind of help clean out any debris or anything that's in your teeth that are just lurking around. Now while we're on rinses, number 2 is a hydrogen peroxide rinse. Now this is something that I would not use daily, because if you do this every day, then it can start to kill also the good bacteria in your mouth, because it will kill a lot of bacteria in your mouth, but you don't want to overdo this because there's a lot of good things in your mouth too. But it's fine if you do on occasion. Now when you do this, you can get that 3% like brown bottle of hydrogen peroxide and then dilute it with an equal part of water. So have half hydrogen peroxide, half water. Make sure you don't swallow it, but same thing, you can swish this around and spit it out. A lot of people don't know this, but our body naturally produces hydrogen peroxide. It's a natural antiseptic. It was used in like World War I to help clean wounds, and actually at this dose, it can be really good for your gums. But again, you don't want to do it every day. Number 3 is actually removing the debris. A lot of times if you have some severe tooth pain or something like that, it could be as simple as like a popcorn kernel or like a Dorito or a tortilla chip that's just stuck in one spot, like underneath your gums or in between your teeth. The amount of times I've seen a patient come in and they're like, there's some tooth pain going on, I have an infection, and then I go in there and I see like this little popcorn kernel and I pop it out and they're like, oh my God, that feels so much better. My real question is like, what movie were you watching? Because you know, I'm always looking for new movies. But the best way to know is if you know it's in like one localized spot, try taking some floss and trying to clean that area. You might not be able to see it, but if you do that C-shaped flossing where you kind of tuck it against one tooth, go underneath the gums and kind of pull it sideways and try to clean the area out, and then go against the other side of the next tooth and then clean up and down underneath the gums. You might get scared because you might see bleeding in that area, but that's totally normal. When you have like a popcorn kernel or like food stuck somewhere, it can cause a ton of pain and it can cause a ton of inflammation. That's where the pain is coming from, but that can also cause a lot of bleeding. So it's fine, the bleeding is fine, but if you get some food and stuff stuck out of there, it will eventually heal. Now it might not even be in between the teeth, it could also be in the back, like behind your most back tooth. This is something called pericoronitis. It's really common when like your wisdom teeth are coming in, because when your wisdom teeth are coming in, they're starting to poke through the gums, but then there's like a gum flap that kind of covers the tooth, and that gum flap can kind of catch some food. So if you get like a popcorn kernel stuck there, that can cause a ton of inflammation and that can be really painful. So even taking like a water flosser and trying to flush those areas out and making sure you get any debris out of there can help too. Now number 4 actually involves some medications. So a lot of times when you have tooth pain, it's usually pain from inflammation. Whether you have like a big cavity that's going close to your nerve, that tooth and that nerve gets really, really inflamed. Or if you have like debris stuck somewhere, that can cause some inflammation. Or if like your bite is off, or if you have jaw pain, all that stuff will cause a lot of inflammation. So the best thing would be something to help fight that inflammation, to help fight that pain. And that would be something like an NSAID. So like an Advil or an ibuprofen would be really useful here. You don't even have to take like something really strong, just getting like over-the-counter ibuprofen and taking it as directed can help. Now some people might not be able to take an Advil, so in those cases like a Tylenol or an acetaminophen would be fine, but it's not going to work as well because acetaminophen doesn't really target the inflammation. Now, if you can take both, one thing you can do is kind of alternate, like every few hours take an ibuprofen and then a few hours later take the acetaminophen. That way, because typically you want to wait like 6 hours after taking the ibuprofen before you take it again. But in the middle, in case you have like more pain coming up and then you can't wait the full 6 hours, now you have that acetaminophen that's still kicking in and helping with the pain. Now, number 5 is cold compress. You can put like ice and wrap it in a towel and put it against whatever side of the face that's hurting and hold it there for like 15 or 20 minutes, take a break, and then do it again. This can also help reduce that inflammation and any swelling if it's present. You might not even see like facial swelling, it might be like localized in the gums or you might not even be able to see, but either way it's gonna help. But just remember, if you have like external swelling, like your face is starting to balloon up and get swollen, that could be like a big infection. So you don't wanna ignore it. Just a reminder, whatever the case is, this is just a temporary solution until you're able to get in and go to the doctor ASAP. Number 6 is elevating your head. A lot of times people don't have as much pain until they lay down in bed. And that's partly because when you lie flat, it increases the blood flow to the area, and then that can kind of make it more painful when you lie down. So kind of propping up your head a little bit with more pillows, or just kind of tilting your bed up a little bit if you have one of those adjustable beds, that can also help just kind of get you through the night. Number 7 is clove oil. Clove oil is like a natural anesthetic, and it contains eugenol. You can put a little bit of this clove oil on a cotton ball and then dab it on your gums, or you can just put it directly on your gums. You just don't want to keep it there for too long, because if you keep it there for too long, it can start to irritate the gums a little bit. But it's like a natural way to kind of numb the area. Now, number 9, something kind of similar, is a peppermint tea bag. This is something that's been recommended not just for tooth pain, but also recovery. If you had surgery or something done, some people recommend putting a tea bag over that spot just to kind of help it soothe and help with the pain. The way to do this is you just want to kind of steep it for a little bit, make sure it's warm, not hot, and then kind of apply it like you would do a compress, a cold compress, just apply it directly to the sore area. Now, next on my list is a vanilla extract. Now, you want to make sure it's pure vanilla extract. You can put it on a cotton swab or a Q-tip and then apply it to the sore area. This is something that can also help kind of numb the pain. Now, with this, you want to make sure you do not swish or rinse with it, because that can kind of irritate your gums a whole lot. So just apply it directly to that area. Now, number 10, the last thing is using garlic. So you can either take a clove and crush it and then kind of rub it against the sore area, or just take that clove and then hold it against the area by itself. This is beneficial because garlic actually has antimicrobial, antibacterial activity. But again, you don't want to keep it for too long, because raw garlic can actually start to irritate the tissue too. So if you have really sensitive gums, or if you have open sores, you might not want to do this one. The biggest thing to remember again is you got to get seen. You might need antibiotics, you might need actual treatment done. So it's important to not ignore anything, because dental pain, usually when it's one of these signs, will not fix itself. So I hope this video helped you out, and I hope that you're not experiencing tooth pain, because that would be the best case scenario. But anyways, thank you guys for watching. If you liked that video, hit that thumbs up button below and subscribe to my channel below, and I will see you in the next video. One thing I see all the time is too many young people treat their teeth like they're gonna get another set. So in this video, I'm gonna go over some of the most common dental mistakes that people in their 20s and 30s make that prevent them from keeping their teeth for the rest of their life. So make sure you stick around, because this could literally save you thousands of dollars later on. Hey guys, I'm Dr. Singh, I'm a dentist, and these are some of the biggest mistakes